You know, there's some people that worry about masks because exactly we don't have the culture. They are afraid that the transmission will be even higher, that they go touch the outside, they do it wrong. How would you advise on that?
Okay, the mask serves two functions. One is prevent me from spreading the infection to you, and it also works the other way where the infection is prevented from coming onto me. But the mask is only good for what comes out of the nose and mouth. We mustn't forget that what our hands may inadvertently touch our eyes, touch our nose,
touch our
mask. Yes, and then in turn the virus will come on.
Dr. Leong, a lot of people have been wanting to wear masks, but because they find it's very warm in Southeast Asia, they've come up with all sorts of ways of wearing masks, like putting it on, then after that, when they need to eat, they tuck it under. Sometimes they hang it on the ear, it drops on the floor, they pick it up, they put it on a table, they put it in their handbag, and then you use it. It gets wet very quickly. Could you just give us some steps of do's and don'ts so that we're all in sync here?
Okay, so I have with me a mask, and most of the time the external surface is actually blue. But if you need to try to decide which is the external, which is up and down, you have a feel first. At the top, you would actually have the metal ridge. That tells me it's the top. Then if you look around, I could open it this way and you realize nothing captures it. But if you look inside, if I were to pull it down, this isn't very ideal because you tend to catch things inside. So it must always open up correctly this way so that there's no chance of picking out any rubbish. You know, you orientate yourself to what's on the top, what's in the front, then you put it on like this. You cover your nose first, loop over the back, hold it to the top of the nose, pull it down slightly. Use the fingers to press on the metal piece, press it firmly against the nose so it acts as a support so that the mask doesn't come down. With this, you're good. Some people have it on the tight behind, that's fine. I like it tight so that it holds this closed, which means that the air can only come forward this way. If you have children who have smaller faces, what you may have to do is to actually double loop it like this. Or what you do is you tie a little knot here so that it becomes tighter and it will fit the face better. Remember, you need to make sure the face here by the sides closely opposes the skin and the cheek so that the breathing air will go through the filtering in front. That's very, very important. Now, what you want to do next is actually to take it off. When you take it off, I will do it very gently. Remember, what's inside the mask will be your own phlegm, your own dirt and stuff. You wouldn't want to share it with anyone. As you let it fall, I would like to fold on itself like this, and then fold again and again into a small little roll and tie on itself. Thereafter, I'll discard it with a tissue that's wrapped around it. Okay? That will be the safest way so that it doesn't get dispersed. If you have it thrown around on the floor exactly like this, then the contents at the back on the inside could get aerosolized. And in turn, you could spread any bacteria or any viruses which are carrying with the discarded mask. That's no good. Masks are really very precious now, and I have been reusing masks. If I want to reuse a mask, I'll take the mask, put it into a clean bag, okay, together with a desiccating gel, so that if there's any moisture, it'll dry it. Any bacteria or any viruses loves moisture. If you get rid of the moisture, then what's left behind will be dried bacteria, dried viruses, or dead viruses, dead bacteria. Drying kills them. It's because of times like COVID-19 that we have to recycle masks. During peace times, I do not recommend you keeping masks or reusing masks.
Can you tell us 3 things that you see will be the silver lining now and after this?
Well, I think because this is a universal crisis, I think it'll bring people together. I think we'll be much closer to each other, we'll be much more sensitive to each other. So you talked about reset earlier. I think too, there are going to be good habits.
Yes,
Yeah.
definitely.
Good habits of hygiene, good habits of, making sure that, we are not the people that are going out infecting each other and all that. And I think too, to some degree, maybe, it actually helps the workplace and all that to evaluate how we operate. Now, I'm not a prophet, I'm not a sage of sorts, but I suspect, if I can work with 40-50% of my staff at home, and when this is finally over, I'm going to have to relook at, how I utilize, office space, how I utilize funds, and whether it may or may not be totally necessary. So the way we operate things, the way things happen, may be actually very different over time. How we actually run a business, And I believe also it's also a situation where we are actually forcing ourselves now to actually go on internet or go on to technology, I am now averaging, maybe about 5 Zooms a week, and that may not be many. I'm sure there are many that are doing a whole lot more. But Zooms for me were like a very by the way kind of thing. If I can't meet you, let's go online, let's go on a platform, let's talk. But now we are beginning to do that. I think things will change. Things will change. So find things that you enjoy. In fact, sometimes getting, having more time is actually a good thing. Maybe you've always wanted to clean up something. Maybe you always wanted to do something, right? Paint a room, clean the mess, pack something, or do something. I have a father, and he said, he's looking forward to actually, because he's now working a bit more from home, and he just shared with me the other day. He said, for his boy is now about 14. He said, how cool is this? He took a photo, and then he started posting it to everybody sending it. He said, how cool is this? Then I'm actually having breakfast with my son in a roti prata coffee shop. And he said, you know what? I could never do that. Yeah.
Now we'll have roti prata at home.
Yeah, well done, yeah. But it was cool. He said, breakfast with my son.
Yes.
I don't have that luxury. Yeah. And so these are things. Don't look for the silver linings. Look for the positive. Look for things that you've always bucket thing that you wanted to do. Yeah.
Thank you, Danny. Thanks so
You're
much.
welcome.
Singapore, we are blessed. We've got a great government, and I know you want to share some appreciation on that.
When I do my clinic work, I'm really very grateful to the government, to the organizations that we work with, to the Ministry of Health, because I also do volunteer work for overseas developing countries. I also have family and friends in other countries. And I feel like as a healthcare worker in Singapore, I'm so blessed and I'm so privileged. The guidelines are so clear and very well thought out and very well researched. So it really gives me that sense of confidence as a frontline worker, knowing that if I'm clear about the guidelines, I keep myself updated, I know exactly what I should do, and I can follow that and go home to my family. I have young children at home, and know that I'm safe and I'm protected when I'm doing my work. So I'm really very grateful in that sense. And like what you mentioned, Singapore is a place where we have a whole concentration of resources, not only in terms of material resources, but also intellectual resources.
Like you're saying, some of the portals are incredible, right?
Yes, it's amazing. So I was just doing home-based learning with my daughter on Wednesday, and I was so impressed with the online learning portal that the government has set up, and it ran so smoothly, and the kid really enjoyed doing her home-based learning. And I think that every step of the way, although there's so many changes week after week, so many updates to keep up on, but I can see that everything is really well thought through by the people out there, and rolled out and implemented in a very, very smooth manner.
You've got one more poem. Would you like to read that out?
This is another poem that I would like to dedicate to my colleagues who are really struggling right now in the primary care setting, in the polyclinics, in the GP clinics, also those manning the ICUs and dealing with COVID patients every day, in the isolation wards, wearing full PPE, including the hairnet, the goggles, the gowns, the gloves, the N95 mask. And they have also shared with me that is wearing the N95 mask for the whole day, a lot of them struggle with headaches,
Yes.
and they feel that the breathing with the full PPE is also quite uncomfortable. And so I would like to dedicate these poems to all my healthcare worker colleagues, including the nurses, the allied health staff, including the clerks at the front line, and those manning the clinics at the reception.
And the cleaners.
And the cleaners, and the porters, and the patient care assistants, and basically the whole, everybody involved in, serving patients during this COVID time. Okay, the poem is entitled Together. Monitors beeping, phones ringing, in the hurried madness of life, let us take some time to remember, for we are soldiers fighting disease, death, suffering at every turn. Those who have courage to be honest with self and have trod this jagged path for long enough will know deep within we have all felt desperate, burnt out, weighed down. So let us, as an army united, embrace humanity in each other. As soldiers united, let us leave no man behind.